Last but very much not least, I'd like to welcome Anne Fordham to the panel. She represents International Drug Policy Consortium, a group very well known to all of you. We just had the privilege participating in the same retreat on international drug policy organized by UN University, and I can tell you you're in for a very interesting presentation. Thank you for being here, Anne.
Thank you very much, Ambassador. Your Excellencies, ladies and gentlemen, and civil society colleagues, thank you for the invitation to speak here today, and of course, thank you very much to the permanent missions of Switzerland, Norway, and Colombia for this opportunity. I also thank them for this initiative to hold these exact same events in all major 3 UN locations in Geneva, Vienna, and New York, in the spirit of encouraging dialogue and coordination between UN missions and UN agencies ahead of the upcoming UNGASS on drugs. I think it's very important to note that, as you've heard, all the preparations for the UNGASS are being led from Vienna by the CND, and we estimate that around 70 member states do not have permanent representation in Vienna. So these attempts and other attempts at dialogue to ensure inclusivity into the debates and the negotiations are of critical importance, especially leading up to the final negotiations of the UNGASS outcome document. I'll also say that so much of what I had planned to say has already been said so many times on this panel, so I may repeat some of those points, and those are obviously the critically important points, but also to say that, you know, hearing from my UN colleagues and you know, the important messages that they have to give based on evidence of work from the field in particular, these inputs also must be reflected in the UNGASS negotiations. And I would like to express a genuine concern that I often attend the debates in Vienna, and to date I do not see that these perspectives are adequately reflected in those discussions and negotiations. We still have time to address that, and I think it's very important that member states try to address that, given the important contributions that the UN agencies have made in the UNGASS process. I'll also say that although I'm here representing the International Drug Policy Consortium, I'm also a member of the Civil Society Task Force for the UNGASS. And we have spent the last year, all 26 of us from many diverse geographical locations and also diverse thematic areas such as harm reduction, recovery, prevention, farmers, criminal justice. There are more as well, which I don't have time to name, but we have done many consultations, and it's clear from our consultations that the priorities from global civil society is a reorientation of international drug control policies towards public health and human rights. I also urge you all to attend the informal interactive stakeholder consultation, which will take place tomorrow, where these issues will be discussed in further detail, and you will be able to hear from many civil society representatives working on the ground, particularly from the Global South. So that's tomorrow at 11 a.m. in the Trusteeship Council chamber, and the President of the General Assembly will open and close the event tomorrow. So I hope to see you all there. So the UNGASS is a rare and important opportunity for member states to have an open and honest debate regarding the challenges and shortcomings of the global response to drug control. If we really are to move towards a people-centered response, then there are some serious questions that governments must ask of themselves. Many rich and diverse discussions have taken place as part of the preparations. It's a complex issue. There is no silver bullet, but it is time to recognize that limited progress has been made towards the global goals that we have for drugs, the target of 2019 for significantly reducing or eliminating the global drug trade, and that it's time for a genuine and considered rethink. It's time to acknowledge that and address the widespread and devastating consequences of punitive laws and repressive law enforcement practices on the enjoyment of human rights for millions of people across the globe. The continued use of the death penalty for drugs offences, which has already been discussed, as a violation of international law. Highly disproportionate sentences for drugs offences, with 1 in 5 people who are in prison globally being sentenced for a drug offence. The burden of highly disproportionate sentences for drugs offences has largely been borne by vulnerable groups involved in the drug trade at a low level, often driven by basic subsistence needs. These include women, who incidentally are the world's fastest growing prison population, involved in minor trafficking offences, subsistence farmers involved in illicit cultivation, and many others who are punished for the simple possession of drugs. It is also time to acknowledge that the narrow focus on preventing drug use and eradicating the global drug market has profoundly undermined public health outcomes in numerous ways, which we have heard here on this panel mentioned already, in particular the criminalization of people who use drugs, a point I will return to, but also the severe lack of access to controlled medicines, particularly in many developing parts of the world. That, however, is an issue on which there is general consensus in the UNGASS debates, and we very much welcome the plans for a global action plan to improve access to controlled medicines. So in the context of the UN drug control debates, we have witnessed a positive trend, I would say, in the language and the rhetoric towards ensuring that public health and human rights are at the center of drug control policies. But how will member states ensure that this is not simply rhetoric? To date, and in the current draft of the UNGASS outcome document, there is little genuine commitment towards tangible operational recommendations. The UNGASS on drugs, both in the actual debates and in the outcome document, must now genuinely live up to the claim that people, public health, and human rights are the central priorities of drug control policies. In the UNGASS outcome document, IDPC and our civil society partners are calling on member states to include 2 distinct pillars or themes, among several other themes, but 1 specific theme on drugs and health, and 1 specific theme on drugs and human rights, under which operational recommendations would be specifically included. But given the time constraints, I'll focus on 2 key issues relating to public health and human rights. The first is to elaborate on the issue of harm reduction. The issue of harm reduction continues to be contentious within the UN debates, but it truly feels that it's time that member states openly acknowledged that harm reduction, both as a concept and a set of interventions, is a central tenet of the global drug control response and is not simply a subset of demand reduction. If the UNGASS is an opportunity to examine what has worked and what has not worked within current drug control policies, by every metric set within the system, harm reduction has worked and should be acknowledged as having done so. Yet human rights abuses against people who use drugs, including those which impede HIV prevention, treatment, and care efforts, are widespread and systemic, and are often driven or justified on the basis of states fulfilling their obligations under international drug control law. However, people who use drugs do not surrender their rights simply because of their decision to use drugs. And in the context of harm reduction, we must remember that there is nothing within international drug control law that legally prohibits states from providing harm reduction services to their citizens. The UNGASS outcome document should therefore explicitly mention harm reduction and call on member states to fully commit to the implementation and scale up of these programs. As we've heard, there's a strong precedent for this, given that in 2011, the General Assembly, in the Political Declaration on HIV/AIDS, called on member states to implement and expand risk and harm reduction programs. My second key point relates to the criminalization and associated violation of human rights for people who use drugs. This is very much related to the point on harm reduction and health outcomes and is very relevant to the UNGASS debate. It is time to openly acknowledge that criminalizing and punishing people for using drugs has not only failed as a deterrent, but is harmful, damaging, and results in serious violations of human rights, justifying harsh measures towards people who use drugs, such as compulsory detention, arbitrary arrest, and harassment. The UNGASS provides an opportunity to address this issue, And the UNGASS outcome document should explicitly state that people who use drugs should not be subject to criminal punishment. In many member state submissions towards the UNGASS outcome document being received in Vienna over the last 6 months, and most notably the submission from the United States, this point has been clearly expressed. It has also, as we've heard, been highlighted in the submissions from many UN agencies, and most recently in UNAIDS' excellent report, which I believe you have in front of you, and also from many civil society organizations, including the Civil Society Task Force. Many governments have already taken steps to decriminalize drug use and possession for personal use to protect the health and other human rights of people who use drugs. And despite the overly punitive thrust of the drug control treaties, they do not require member states to criminalize drug use or possession for personal use. This flexibility within the UN treaties on drugs has long been established. If the UNGASS is truly going to move us towards a people-centered, public health and human rights-based approach, a loud, clear pronouncement that acknowledges this leeway and calls on member states to end criminal punishment for people who use drugs is a crucial and important first step. To conclude, I've only been able to address a fraction of the issues of concern with respect to drug policy, public health, and human rights. The punitive and damaging nature of the international drug control regime, underpinned by a treaty framework that contains some outdated elements, are key issues for the IDPC network and many civil society organizations from many different thematic areas and from all over the world. There is a very problematic incoherence between different policy objectives that now must be addressed, and we welcome some of the positive developments and discussions that are within the UNGASS debates around public health, around proportionality of sentences, and around access to controlled medicines. But other UN commitments, in particular the SDGs that have already been discussed, provide an important overarching framework for improving policy coherence, and drug policies must contribute to, rather than undermine, the achievement of these important goals for human development. It's time to ensure that international drug control meets the broader goals of the UN, public health, human development, human security, and human rights. And as we've heard from many of the previous speakers, many lives are at stake, and the UNGASS must be a forward-looking moment that reflects this urgency. Thank you.
Thank you much.